Who do you think within the hospital community is against this?
I think the AHA is supporting the issue that the hospitals have with those post-acute providers. Bill, why would we want to hold the hospitals accountable to connect to post-acute providers, home health agencies, and other providers that do not want to follow meaningful use? When I was at Ochsner in New Orleans, we actually hosted for the entire state the electronic mailboxes of everybody. The entire state. I pulled all the CIOs together from the entire state, and we looked at all of the recipients of our transition of care meaningful use requirements, and we contacted all of those. We gave them electronic mailboxes, and we hosted the directory at Ochsner for the entire state so that we could all meet meaningful use, transition of care, electronic delivery. Because those post-acute providers refuse to comply with meaningful use, and putting that burden on the hospital is, I think, the AHA's position, is they don't like that because it's going to impact the hospital's ability to comply. And the COP, the condition of participation, that has big teeth, right? So I think that's the AHA's position. We have to figure out how to get those smaller post-acute providers, those rehab units, rehab hospitals, whatever they are, to get them online. So it is the interoperability issue. Somehow we have to break that.
Yeah, but so we saw this with bundled payments and the programs which have actually been ratcheted back recently. But in those models, we were required to take responsibility for the quality of post-acute care. And again, it's the same thing. I mean, if a majority of the money flows through the hospitals. So this is why you go to the hospitals, and the hospitals do control where those patients get referred to. And so they become the 800-pound gorilla. And it's the way to get those post-acute care providers aligned. You and I both know there's just no money in home health. I mean, it's at least today and it's typically a pretty starved group of organizations. So how do you get them to share that data and to move that data around? And I think, it has to be financial mechanisms. And if the referrals are coming from the health system down into the post-acute care facilities, what we started to do was we started to look at each of those. We gave them quality scores, metrics they had to hit. Most of them were below those metrics. And then we gave them timeframes for moving up. So I think it's a lot better than other mechanisms. So the best mechanism is to have local providers working with local post-acute care facilities to drive them forward. I agree with you. It's a huge burden on the health systems. And if the health system outside of the referral network, if the health system doesn't really have a mechanism for driving that change, it becomes very, very hard to do from a leadership standpoint. But I just think it's so important to get that data across that entire spectrum.
Sure. Incentives seem to help, I think, better than penalties. So maybe if we could develop an incentive way for these post-acute providers to get online, maybe there could be some potential there. But penalties against the hospitals may not be the right approach. But I agree. Obviously, something has to happen, and I think collaboration is the beginning to the end.
Cool. All right. Well, yeah, we'll have to see how that one plays out. So let's get into the soundbite section.